Len Bruce, Executive Director of Medical Services, Murrumbidgee Local Health District.
Everyone happy?
Yep.
Ready to go?
Len, we've got quite a exposure in Wagga. Can you tell us what's going on?
Yeah, so just an update in terms of case numbers. There's been one new confirmed case of COVID-19 in the Murrumbidgee Local Health District until 8 o'clock last night. It is a case in the Hilltops local government area. It is an individual who is a known household contact of a known case, and the patient's been in isolation. And those case number will be added to the New South Wales numbers for today. There is, however, another case that presented to Deniliquin after 8 p.m. last night, and that case number will be added to the New South Wales data for tomorrow. So the number of cases now for Hilltops is 19, and for the Albury LGA is 7, which gives us 26 cases in the current outbreak. The 2 cases that were from Wollongong, and that's currently admitted to Wagga Base Hospital, would obviously not be counted as Murrumbidgee numbers or Wagga LGA numbers. Their numbers will be added to the LGA where they normally reside. There unfortunately has been additional exposure sites identified this morning. So the Wagga Wagga Big Barber and Sturt Mall, Sunday the 26th of September between 12:30 and 1:15. The Junior Hotel, Sunday the 26th of September between 10 to 4 and 8 o'clock at night, so that's quite a significant exposure period. Wagga Wagga Kmart, Monday the 27th of September between 18:15 and 19:15, so 6 p.m. and 7:15 p.m. Also, Sunday the 26th of September, 12 to 12:45, that's Kmart. Wagga Bunnings, Monday the 27th of September, 13:10 to 13:30. And then Wagga Aussie Disposals, Sunday the 26th of September between 12:45 and 1:05. So if you've attended any of those premises between the times that are indicated, you need to have a COVID test and isolate until you get a negative result. So there's significant testing capability once again with our private providers, our drive-in testing centre, and there's obviously special testing arrangements for Murrumbidgee Local Health District staff. So please, if you've been to one of those areas, get your COVID test and isolate until you get a negative result. The other bit of good news is that this morning New South Wales Health has changed its advice in terms of vaccination, and all adults over the age of 12 can now access Pfizer. So in other words, it's not the case that if you're over 60 you cannot access Pfizer. So if you've not had your vaccine yet, please go and see your GP or go to your pharmacy and get vaccinated as soon as possible. Any questions?
Yeah, just in regard to the Wagga exposure sites,
Yes.
How cooperative have the people from the Illawarra who are in Wagga Base Hospital been with contact tracers in identifying potential COVID sites in the local region?
So the interviews were conducted by Public Health, and clearly they've been forthcoming with a lot of information, so I can't really comment on the exact interaction, but clearly they've been happy to provide information of sites that they visited. Contact tracing is a complex matter, and it does take time, so there could be more exposure sites that come to light, so it's important that the community of Wagga remain vigilant.
And how concerned are you about that list of exposure sites in Wagga?
Well, I'm obviously extremely concerned because there's been multiple exposure sites for individuals while they were infectious. We know the Delta variant is extremely contagious, so we are concerned, and that's why we will enhance testing once again, make sure as many of our communities vaccinated to protect us as best we can. exposures have been, quite a number of days ago. So it's really important for anyone with any symptoms to please go and get a COVID test as quickly as you can.
And can you give us some more information in regard to the case in Deniliquin, which will be included in tomorrow's figures? When you say it's being cared for in Deniliquin, is that in the Deniliquin hospital or at home in Deniliquin?
No, the patient presented late yesterday and was admitted to Deniliquin Hospital, and the patient is awaiting transfer to Melbourne as per the Victorian pathways for COVID patients.
Dr. Lynn, can you talk about the cases that are in the hospital at the moment? Do we still have 6, including the 4 that were still here from Hilltops? And with the 2 that are here, are they being held here, or are they sick enough that they need care here? Why are they in Wagga Hospital and not sent back to Wollongong?
So both of the individuals were involved in a car accident, and it's quite common for us to keep patients in hospital for observation and conduct things which we call tertiary surveys to make sure that we review them a day or so after the accident to make sure nothing has been missed. So they are currently in hospital for observation.
Just back to Deniliquin briefly, do you know if that person was infectious while in the community?
I don't have that detail, so we were only made aware of the case last night, so public health is busy doing contact tracing as we speak. So we really, I was contacted at about 11:30 last night.
Given that's a small rural hospital and there's already concerns in Deniliquin about potential staffing of that hospital once this vaccination mandate deadline is reached tonight,
Yes.
are you concerned that a patient has potentially exposed staff at Deniliquin by presenting to the hospital, and does that add to the concerns about staff shortages there?
So all our facilities have a COVID-safe plan, in other words, where the hospitals have a policy and procedure to manage essentially COVID suspect patients, because the majority of patients that will present will have symptoms or suggestive of COVID, but we may not know whether or not they're COVID positive or not. And we have processes to manage those patients in a safe way and minimise staff exposure. There is a CC developed risk matrix where staff that have been exposed to a COVID positive patient is risk assessed, and we then manage them as appropriate. But that process is ongoing, and staff that will need testing and isolation until results come back will be managed as appropriately.
So at this age you can't say because that process is ongoing?
The process is ongoing, and it depends on level of PPE worn, how long they were in contact with the patient, how far they were of the patient. So once again, as contact tracing, it is a process that is time consuming because we have to get it absolutely right. But that will be completed as soon as we can.
Lynn, how frustrated are you with these 2 people who are not supposed to be in the Wagga area? We've done so well free from COVID. We've had 2 people who didn't have a permit, aren't supposed to be here, come here and list a whole bunch of exposure sites that are quite high risk, if we're honest. How are health authorities feeling about that? Are you frustrated? Are you, what's the vibe?
It's actually disappointing. The public health orders are in place for a very specific reason. As healthcare providers, we do not want to limit the freedoms of individuals unless it's absolutely required. So it is disappointing when individuals do not do the right thing and then expose a large community that actually has been doing the right thing for a number of months. So it is disappointing when individuals do not follow the rules because they're once again exposing themselves, family, friends and other communities, and yeah, it's disappointing.
Can you confirm if the recent exposure sites in and around Wagga are linked to those 2 people from Wollongong?
Yeah, so the exposure sites that have been identified today are all premises attended by those individuals.
Can you give an update on the condition of the people that are being cared for in Wagga-based hospital from the Hilltops region who've been here for some time? How they're going? Are they any closer to being well enough to be released?
So we have released some of the patients, discharged them back home. There is still one of the patients being cared for in the intensive care unit, and then also some other patients in the COVID ward.
So is that a new patient you? Because I understand
No,
there's
no.
one that came back.
Yeah, no, the patient that's been has been in for a number of days.
So, in total, how many people in the COVID are being cared for with COVID here at Walker-based Hospital at the moment?
There's the one patient in ICU, and then I think there are 4 additional patients, but I might just need to double check because we may have discharged some patients this morning. So what we'll do is we'll take that on notice and we'll get you the exact details.
That's fine. And obviously the deadline for health vaccination is today. I understand MLHD has quite high numbers as far as staffing
That's right.
rates vaccinated. Can you just give some clarity around how well we're doing here?
Yeah, so our staff has obviously cooperated extremely well with the public health order, and our vaccination rates are more than 99%. And for that small percentage of staff who's not vaccinated, some will have exemptions. Some of the exemptions are temporary, some could be permanent, very rarely though. And we're just working with them to make sure that they remain safe and that we can also, comply with the public health order.
Do you have a number on how many staff members in the MLHD will, I guess, have to step down after the deadline is reached today?
Unfortunately, I don't have that exact detail because of that 0.85%, some of the staff members will have an exemption and they are then not required to be vaccinated if they have a valid exemption. So I don't have that exact number, unfortunately.
That's okay. Did you know for Deniliquin, specifically how many staff members they'll be losing at the hospital?
No, because the staff still have an opportunity to get vaccinated today. And once again, if staff provide evidence that they've got an appointment, tomorrow, we will remain reasonable. But I don't have those exact numbers, unfortunately.
No worries. And if someone had to step down after today, but in 2 weeks' time they decided, you know what, I'm going to get the vaccine, could they potentially come back to work, or would it be too late by then?
It depends on the process that is outlined by New South Wales Health. I'd strongly encourage anyone who's considering vaccination to get vaccinated as quickly as possible. We have exposure site of COVID in Murrumbidgee and in Wagga, so it really, really is in their best interest to be vaccinated as quickly as possible.
Len, we've had a couple of calls into our office overnight about, we interviewed a nurse from the MLHD who's come back from retirement to help with the COVID pandemic. We've since had a few calls going, how do I get involved if I want to do that? So for nurses or medical staff out there who might want to get their registration redone and come and help, who do they contact, how do they get involved?
So they can contact our People and Culture group, and they will be able to provide them with all the information. And there's quite a significant number of staff on our surge list that we can do, and so they'd be more than welcome to come and join us as long as they've made sure they're vaccinated.
Thank you. Also, I've been hearing that the testing rates in and around Wagga might be dropping a little bit. Is that a concern for you guys, and would you encourage everyone to get out there and keep getting tested?
Well, most definitely, especially considering the current situation that we're facing. If you've been to one of those exposure sites, please go and get a test and isolate until you get a negative result. If you're symptomatic, please go and get tested as soon as you become symptomatic. One of the concerns for us, though, is still individuals delaying testing when they've been unwell for a number of days. And unfortunately, the serious complications of COVID happens at a very specific time in your illness course. So if you delay your testing too long, we will not be able to care for you when you're at your most unwell. So it's really, really important with the mildest of symptoms get tested.
And just to confirm, the 2 people at Wagga Base from Wollongong, are they being counted in the MLHD's numbers or for their home LGA?
No, so they'll be counted in the LGA where they normally reside.
Mm-hmm. And just with the Hilltops LGA, have any results come back from the genomic sequencing of the young index case? And do you know the source of the outbreak there?
Unfortunately not. It's once again a process that takes time, and at the moment we don't have the result of the genomic sequencing for the young outbreak. But when we have it available, we'll provide it to you.
We had 2 more exposure sites come out for the Wagga this morning. Are we expecting any more, or do you think we've kind of got them?
I haven't spoken to the public health unit today, but I believe that the discussion with those individuals will be ongoing, and I think it's important that the community remain vigilant because there could be more sites that pop up, especially over the weekend.
And with the new case announced in the Hilltops LGA this morning,
Yes.
is the health district feeling confident with the LGA coming out of lockdown tomorrow?
Yeah, because the case that was announced today is a household contact of a known case. So it's not a sort of undefined community transmission where the source is unknown, which is always concerning for us. But I think it really is important that the community must remain vigilant. The measures that have kept us safe, don't go out unnecessarily, wear your mask, practice social distancing, and practice hand hygiene.
So what kind of preparations is the MLHD making for October 25, when there'll be possibly a lot more people coming into the region from Sydney and the coast and the like?
So it obviously is a time of concern for us, the fact that the Delta variant will be around. Obviously our first step in preparation is vaccination. We know that individuals who are vaccinated are far less likely to become severely unwell. Having a COVID vaccine reduces your risk of hospitalisation by 90%. So that's really our first and most effective strategy. There is obviously significant contingency plans being put in place to be able to increase capacity for potential COVID patients. But then what's also important, a large part of our work is to make sure that we have enough resources to care for non-COVID patients. So plans are in place to make sure that we can surge ICU capacity for COVID and non-COVID patients. There will still be urgent surgical procedures that would need to be done, emergency cases and urgent elective cases, and there's once again discussions with other providers to have a Murrumbidgee-wide strategy to make sure that we care for our community as best we can.
With all these police that are having to isolate because of these two individuals, do you know how long that period is? Do they just isolate till they have a negative result, or are they considered close contacts and do 14 days?
Yeah, so we would need to clarify their exposure, and that would have been done by public health, and whether or not they wore PPE or not, and the type of PPE they wore. But if you're identified as a close contact, you have to isolate for 2 weeks.
All good? Right. No,
Thank you.
Thank you.
Thank you.
Thanks so much.